Welcome to today's HealthLine webinar from the American Association of Kidney Patients, titled Love Your Kidneys, Optimal Nutrition for Overall Health. Thank you for joining us for today's event. My name is Jerome Bailey. I'm AAKP's Director of Patient Engagement and Advocacy, and I'm pleased to be the moderator of today's program. As the oldest and largest fully independent patient-led kidney patient organization in the U.S., AAKP is proud to host our webinar series as a service to our fellow kidney patients, family members, and care partners, healthcare professionals, researchers, and policymakers. AAKP's HealthLine and HealthLine Innovative webinars fall under our Center for Patient Research and Education. We believe patient and care partner education is an integral part of an individual's treatment. And to that end, AAKP is a champion for full patient care choice, the protection of the patient-doctor relationship, and the elimination of artificial barriers and government determinants of health that impede patient care choice and access to all FDA-approved treatment options. At AAKP, we work to ensure that patients have a central role in the research and innovation process so that unmet needs are identified and unique patient insights and lived experiences are part of the overall design to determine optimal approaches and strategies for the development of and access to new products. To garner patient insights, AAKP built this center with the latest polling and engagement technology so kidney patients are also at the core of informing federal, academic, and private sectors in shaping the next generation of healthcare services, assistance programs, and innovative new treatments. We encourage you to respond to our flash surveys and other engagement opportunities that you receive via email as a member of AAKP to make your voice heard. To start today's program, we all recognize that diet and nutrition play a vital role in managing kidney health and preventing complications such as fluid overload and imbalances in key nutrients like protein, potassium, and phosphorus. Making informed dietary choices tailored to individual needs can support optimal kidney function and overall well-being. In preparation for this webinar, AAKP conducted a food and nutrition flash survey through our Center for Patient Research and Education. Let's take a look at some key findings. 80% of respondents reported that a physician or healthcare team member advised them to modify their diet. When asked which nutrients they were instructed to monitor, the top two responses were potassium and sodium. On a scale of 1 to 5, most respondents rated themselves a 4 in their ability to follow a kidney-friendly diet. More than 50% of respondents have had a one-on-one appointment with a registered dietitian specializing in kidney-friendly eating. A remarkable 92% of respondents share that they read food nutrition labels when shopping. Over 70% of respondents prepare their own meals, while 21% receive support from family members. Nearly 80% use fresh ingredients for meal preparation, while 17% rely on frozen food and 3% use canned or boxed foods. Respondents also rated themselves a 4 out of 5 in their ability to read and understand the food nutrition facts label found on packaged foods. Overall, these survey results highlight the proactive efforts kidney patients are making to follow a kidney-friendly diet. Your engagement and commitment to better nutrition are commendable, and we appreciate your participation in this important discussion. Moving on, we have two great speakers today, beginning with Edith Yang. Edith is board certified in renal nutrition, a certified lead therapist, and the founder of Healthy Mission Dietitian, Inc. Her practice focuses on preventing and managing chronic diseases through personalized, sustainable nutrition strategies. She is passionate about empowering individuals to take charge of their health and making healthy eating both accessible and enjoyable. Edith, I turn the program over to you.
Thanks so much, Jerome. Hi, everybody. I'm so happy to be here and super excited to present to you this month on loving your kidneys through optimal nutrition. Yeah, this is the perfect month for this, for Valentine's Day, giving love to not only the people around you, but for your kidneys as well. So today's presentation, we are going to be diving deep into what kidney disease is and helping you to understand kidney disease as well as the role of nutrition in kidney health, learning how to apply practical dietary strategies to love your kidneys, and then also how you can support your kidney health and improve your quality of life. So a little bit about me before we begin. I am a registered dietitian and I have been for over 10 years. I am board certified in renal nutrition, a fellow of the Academy of Nutrition and Dietetics. I also have authored a cookbook specifically for kidney disease, and I am the owner of a private practice that is insurance-based. It's a group practice that does help to focus on wellness and preventing or managing chronic diseases, including kidney disease. We work with people of all ages from different walks of life and with different health conditions. And the mission of our practice is to empower diverse communities with accessible, evidence-based nutrition guidance to help individuals make informed choices to promote wellness, prevent chronic disease, and enhance enjoyment of food and life. And so, again, that's why I'm really excited to present today on kidney nutrition. So a brief overview about chronic kidney disease. 1 in 7 adults do have chronic kidney disease. That's quite a bit of people that are impacted in the United States. And over 90% of people with kidney disease don't know that they have it. And 1 in 3 adults are at risk for kidney disease. And then for those who do have kidney disease that wasn't managed and did progress into end-stage kidney disease, that's nearly 808,000 people in the United States who are impacted. And then for transplant, we are pushing more or hoping that more people do get transplants. So as of 2023, February, there was 88,658 people on the waiting list. And in 2022, it was recorded that 25,000 kidneys were transplanted. So again, hoping for more of that in the future. So what do our kidneys do? Our kidneys do a lot for our bodies. They filter about 50 gallons of blood daily to remove waste products, toxins, and any excess substances. The kidneys also help maintain fluid balance. So what that means is that they help to manage our body's water levels by adjusting our urine volume based on our hydration status. They also function with electrolyte balance, so maintaining our sodium, our potassium, our calcium, and phosphorus levels. The kidneys also help to control blood pressure. The kidneys produce an enzyme that helps to regulate our BP by controlling the constriction of our blood vessels, as well as maintaining that sodium balance, which helps with our blood pressure. The kidneys are also involved in hormone production, so producing red blood cells, as well as maintaining healthy calcium and phosphorus levels. And then they also help to maintain our acid-base balance, and that is maintaining our pH to prevent our blood from becoming too acidic or too alkaline. Our bodies like to be in homeostasis, so we don't want to be too high or too low. And then they also help to support other organs in our body. So what causes kidney disease? As you can see on the slide, there are lots of different factors that can cause kidney disease in people. 2 causes of kidney disease are diabetes and high blood pressure. So those are very common conditions that many people do have, and without adequate or proper control of those conditions, then the kidney disease or the kidneys are impacted. And then if you continue to not control them, then that can also kind of cause your kidney disease to progress further down the different stages. But there are also other factors that can cause chronic kidney disease. Glomerulonephritis, inherited diseases. So if you do have genetic conditions within your family, then you may be at higher risk for developing chronic kidney disease. During birth, there's also risk of malformations. So in the fetal development stage, there can also be kind of those abnormalities with kidney development. Immune diseases such as lupus, obstructions. So if you are someone who does get kidney stones or have an enlarged prostate, that can also potentially lead to kidney disease. Repeated urinary tract infections, if you have kidney infections, older age. So it was studied that had found that after the age of 30, I believe that there is that just natural progression in kidney disease. So just a declining kidney function, not necessarily that you will progress rapidly, but there is a little bit of a decline with aging. And then certain ethnic groups were found to have kidney disease. Also, medications can have a really strong impact on our kidneys as well as other organs. For kidney, particularly, use of NSAIDs, so non-steroidal anti-inflammatory drugs, can also impact the kidneys. Obesity, so having a little bit more weight on the body, and then heart disease as well. So quite a few things that can impact our kidneys. There are 5 different stages of chronic kidney disease, and they are differentiated based on the glomerular filtration rate, and that is estimated based on your blood creatinine levels. So stage 1 is a GFR of 90 or above. There is some kidney damage with normal or increased GFR, but at this stage, you're not really noticing anything, not really any symptoms at this point. Stage 2 is when your GFR is between 80 to 89, and this is staged as a mild decrease in your GFR. Again, at this stage, you may or may not be experiencing any symptoms, and there may not be any sort of treatment plan that necessarily has to be implemented at this point. At stage 3A, or at stage 3, it is separated into stage 3A and 3B. For 3A, it's a mild to moderate decrease in your GFR, and your GFR is between 45 to 59. At stage 3B, your GFR is between 30 to 44, and that is considered a moderate to severe decrease in GFR. Stage 4 is a GFR of 15 to 29 with a notation of being severe decrease in glomerular filtration rate. And then stage 5 is a GFR of 15 or below, and that is diagnosed as kidney failure. Although the blood results and what that indicates for your glomerular filtration rate or GFR is important, we don't only look at the blood, but we also want to take into consideration what's happening in your urine. As I discussed earlier, the kidneys do filter fluids and urine, and so we want to take into consideration what's happening there as well when diagnosing the severity of a person's kidney disease. So this is what's called a CKD heat map. You can find this on the National Kidney Foundation website. And basically, if you do have more protein spilling into your urine, that is considered a little bit more severe, but it does depend on where you are with your GFR. So we want to look at both your blood and urine to determine kind of where you are on the stage of kidney disease. So nutrition in kidney disease is super important and has a really big role in how your kidney disease can be managed and delay that progression. So with proper nutrition support, you can delay that kidney disease progression, where there is improvements in your creatinine levels in the blood, increased GFR, so increasing filtering of the kidney filtering units, and then delay that dialysis start. With adequate nutrition, we do see improvement in any symptoms. So like I mentioned, at earlier stages, you may not necessarily have any symptoms that you feel or necessarily can see. However, in the later stages, there may be some of those symptoms. At any stage of chronic kidney disease, however, it is possible with proper nutrition and lifestyle changes to prevent any more disease progression and have improvement in those symptoms. The more common symptoms that I've seen in my practice are symptoms of uremia, acidosis, so the blood pH is a little bit more acidic than what we want it to be. Some people do experience swelling, higher BP or uncontrolled blood pressure, and then also potential changes in our mineral bone status. So maybe changes with calcium, vitamin D, PTH. And then with proper nutrition, there will also be improvements in other comorbid conditions. So people that do have chronic kidney disease may also have other conditions like the diabetes, the high blood pressure, cardiovascular disease. And when we are treating with nutrition treatments or nutrition treatment plans, we do also see improvements as far as people's blood sugar, blood pressure, cholesterol, and other factors as well. So what is the kidney diet? I love asking my patients this question just to kind of get to know what they already know at baseline or what they've seen and heard. There is a lot of information out there online. Not all of it is correct. So that's something that I do want you to think about right now. What do you know about the kidney diet? And then we're going to dive deeper into what is correct or what should be consumed on a kidney-friendly diet. Protein. So protein is one of the big things that definitely gets thrown around when talking about kidney nutrition. Protein is really important for our bodies. We do need it. Protein has a lot of different functions that helps us to build and repair tissue, helps us to maintain appropriate body function, and it also can provide us with energy to just do our day-to-day activities. Protein needs do vary depending on where you are at your kidney stage. So for example, stage 1 and stage 2, you don't need to be too far off from normal for most people. However, when you get to the later stages of kidney disease, we do need to modify the protein intake based on your specific condition. So if there is too much protein consumed in the diet, it is a little bit harder on the kidneys to process, and there can be more protein spilling into your urine and have a little bit of a stronger or heavier load on the kidneys. But if you don't have enough protein, there can be muscle loss and protein energy wasting. So we don't want that as well. So it does need to be a balance. So while you may read online, limit the protein or maybe eat more protein, you do need to be careful because everyone is going to have a little bit of a different protein need. So it's best to work with a healthcare provider to figure out what's going to be best for you. Sources of protein. So there are animal sources of protein as well as plant-based sources of protein. And as you can see, I've listed some options. Eggs, chicken, fish, lean meat, dairy are the common ones for animal proteins. And then for plant-based, there's tofus. Beans, there's a ton of different types of beans that are eaten across different cultures. And then lentils, as well as nuts and seeds, can also provide protein in our diets. Sodium. Sodium is also a big player in kidney nutrition. We definitely need sodium in our diets, but I do know that many people, once you hear you have kidney disease or high blood pressure, you work on kind of limiting or eliminating sodium. However, you still need sodium in the diet. Sodium has many functions, including fluid balance. It helps us to also support our muscle and nerve function, helps with maintaining blood pressure. So we want a good stable blood pressure. We don't want to be too high, but we also don't want to be too low. And then it also plays a role in that acid-base balance. Again, sodium needs, along with the other nutrition needs, may vary based on your specific needs. So everyone might need a little bit of a modification on these recommendations. But in general, we do recommend that adults aim for less than 2,300 milligrams per day. And to put that into perspective, 1 teaspoon of salt does contain 2,300 milligrams of sodium. So you do want to be mindful when adding salt into your cooking. You may not want to add salt in the cooking, but maybe adjust it. Maybe limit the added salt, but use other methods to flavor and season your food. And again, to reiterate, low sodium does not mean no sodium at all. So definitely include some, but in a moderate amount to help to manage your blood pressure. Potassium. So potassium is another major player. Definitely something that many people are afraid of when talking about kidney disease, or once you're diagnosed with kidney disease. I have many patients who just come to me saying that they completely eliminate all potassium based on what they saw online. However, just like sodium, potassium is something that we do need in our diet. Potassium also has multiple functions in our body, such as with nerves and muscles. It also helps to maintain that fluid and electrolyte balance, helps us to regulate our heartbeat and balance out the blood pressure. So sodium and potassium do kind of are like team together, where you kind of need to balance both of them out to make sure that there's not too much or too little of either one. Again, same with the sodium, the potassium. If there's too much or too little, that is not good for our hearts and our bodies. So we want to maintain a good balance. Almost all foods do contain potassium, and I will dive a little bit deeper into that in a few slides. But they all contain, but there's different amounts. And then there are some foods with potassium that also contain other components like fiber, vitamins, minerals, phytochemicals that are really beneficial to our body. So this is one that definitely still want to include, but just to be more mindful and make more educated choices when choosing potassium containing foods. Phosphorus is another important mineral that plays a role in many body functions. The main functions of phosphorus are to support our bone and teeth, help us to produce energy, build and repair cells, as well as help to balance pH. But not all phosphorus is absorbed the same. So when we're choosing phosphorus from organic sources, and what organic means is more the natural sources, so from foods like fruits, vegetables, animal products, and plant foods, we are not absorbing all of it. The absorption is about 40 to 60, maybe up to 80% absorption for organic phosphorus. For plant foods, there is even less absorption of phosphorus. So from things like nuts and seeds, which I do see many patients commonly kind of avoiding that because they're worried about the phosphorus content. We're not absorbing all of that phosphorus, and that's because a lot of the phosphorus is bound to what's called phytate, and the human body does not break that down. For animal products, there is a little bit higher absorption rate from the phosphorus from animal products, but the one phosphorus component that we do want to avoid are phosphate additives or things from phosphate salts. And this is a food preservative, and there is a near 100% absorption rate for that. So when you're looking at foods and food products, you do want to take a look at the packaging on the label, specifically from the ingredients list, because that is where they will list if they've added any sort of phosphorus. And it usually starts with the letters PHOS, or you'll see phosphate, phosphoric, something along those lines. And for those products, we do want to try to limit our consumption of those because there is a higher absorption rate from those phosphate additives. The old renal diet. When I started off as a dietitian and when I was working in a skilled nursing facility and at the hospital, we kind of had a very bland, very plain kidney diet. And it typically looked like this. It was rice, white rice, chicken, very plain chicken, and then carrots, maybe green beans, maybe broccoli, or this cucumber as you see on the screen. So it was a very bland diet. Not to say that this isn't tasty, but it was very, very bland. We were very worried about patients' potassium, phosphorus, and just really wanting to limit everything as minimally as possible. But now things have changed. So the old renal diet, as I mentioned, no whole grains, no legumes, no lentils, no nuts and seeds, and sticking to a low potassium diet across the board for all patients. However, as we've come to advance in healthcare and doing more research and finding out more things, there is a new renal diet that is recommended, and it is one that is more colorful, that contains more whole grains with a focus on more plants, specifically plant proteins, and lots of fruits and vegetables. So the Mediterranean diet is one that is highly recommended in this new renal diet that we're recommending to patients. And the one thing that we are limiting is additives. So kind of trying to reduce any sort of phosphorus additives, potassium additives, or any other kind of man-made ingredients, and focusing more on fresh whole foods where possible. And then as far as potassium and phosphorus, we do want to individualize that based on every patient's condition and what their lab values are showing us. The updated renal diet, that is what you see on the screen, lots of color. So when we kind of compared that to the previous picture with the chicken and the rice and the cucumber, very bland, but this one is more vibrant. And these foods are going to offer much more nutrition and fiber and just be more protective and offer more nutrition to protect the organs in your body. The benefits of a plant-forward diet for kidney disease. So as I mentioned earlier, nutrition is a major player in how your kidney disease can be managed and delaying that disease progression. So with the adequate nutrition to support your kidney health as well as supporting your other organs, there is delayed kidney disease progression. There's also going to be improved gut health and immune function. So again, with these foods that are more colorful, you're going to get different vitamins like vitamin C, vitamin K, vitamin E, and other components that are going to help with feeding your gut, feeding your organs, and also promoting healthy immune function. There's also going to be improvements in that acid-base balance. As our kidney function declines, we do see more acidity in the blood. So when we provide more foods that are more alkaline, and that's foods coming from more alkalinity coming from plant foods like fruits and vegetables, we do see an improvement of the acid-base balance. With that, we also see improvements in blood pressure. So I have many patients whose blood pressure was more uncontrolled, 150s, 160s. With medication, it was still unable to be controlled for some of them. But once we kind of modified their diet and included more nutrient-dense foods, we did see improvements in their kidney function, also improved quality of life. So many patients come to me and they're just afraid of foods. They don't know what to eat and they just stick to very bland, very white foods just because they've seen online or heard some misinformation about needing to limit foods. But when we again go for a more healthcare provider guided diet plan, we can open up the foods that are included in the diet for kidney disease patients, and that just improves quality of life. Food is such an important part of our day-to-day, a part of our culture, a part of our celebration. And so being able to make educated choices on food that not only nourish your body and help to maintain good kidney function, it can also nourish your soul by, tasting good and you're still able to be included in celebrations and events around you. And then a plant-forward diet is also in alignment with the recommendations for other common conditions as well. So cardiovascular disease as well as diabetes. The literature is showing that a more plant-forward Mediterranean-style diet plan is going to be one that helps to manage those conditions as well. So as I mentioned earlier, potassium, it's in a lot of foods. And I know that when maybe you see your healthcare provider, you may be provided with a potassium list of foods to avoid. However, some of that information might be outdated. Things are always changing. So I wanted to present to you a few different common foods that I've seen that people are avoiding, but such as tomatoes and nuts, but to also show you that in foods like chicken and salmon, is also higher amounts of potassium as well. But again, take this lightly. Everyone is going to be different. And many people with kidney disease may not even need a potassium restriction. So definitely talk to your healthcare provider about what your labs are looking like and what plan you should follow. But I did want to put this into perspective. When you see a list of no potatoes, know that in a serving, which this is based on the USDA food nutrient database, per 100 grams of a Roma tomato is 193 milligrams of potassium. And then the same amount of chicken, for example, there's 239 milligrams of potassium. So again, don't unnecessarily avoid something, but just be educated and aware that potassium is in a lot of foods. So there are some people who may need to limit potassium. However, also something to point out is that there are other factors that may impact your potassium levels. It's not only coming from food, but it can be from other causes as well. So again, that's something to talk to your healthcare provider and your dietitian about. But if you did need to leach out some of the potassium or other minerals from food, you can boil your food to kind of decrease that content. So boiling foods can reduce phosphorus, sodium, potassium, and calcium. And how much is leached out or how much is boiled out or demineralized from the food does depend on what the food is, as well as the form of the food. So if you chop something smaller, obviously there's more surface area that's being boiled, so more of it can be leached out. But if it's more whole, then there might be less minerals leaching out of that when you boil it. In summary, the kidney-friendly recommendations have changed over the years, and now we are recommending a more plant-forward or plant-based diet. And I say that because it doesn't mean all or nothing. It doesn't mean you have to be a vegetarian or vegan, but we do want to choose more plant foods coming from a wide variety of different sources. And we do encourage limiting animal proteins, particularly red meats, but that doesn't, again, mean necessarily completely avoid, but we do want to limit that. Again, plant foods do offer much more nutrient density, so that is why we gravitate towards those. You want to eat more fruits and vegetables. There's generally no vegetable that is off limits, and most fruits are okay except for star fruit. For sodium, again, the limit is no more than 2,300 milligrams, but everyone's need is going to be different depending on your current health status. Potassium, generally not restricted, but it does vary across patients. So again, really talk with your healthcare providers to find out what's going to be the recommendations for you. And then phosphorus, same thing, adjust per your needs, but be aware and mindful of phosphorus additives. So there's tons of great resources online. And I just wanted to list a few really great sources that are reputable. Of course, the American Association of Kidney Patients, the National Kidney Foundation. If you are looking for a renal dietitian, the National Kidney Foundation does have a resource on finding a renal dietitian in your area. There's also the Academy of Nutrition and Dietetics Renal Practice Group. And there are also lots of great apps that you can utilize as well to check on nutrition and more up-to-date research on kidney health. Thank you so much for joining me in today's presentation. On the slide here are some of the ways that you can connect with me. I'm on Instagram, TikTok, and I have a website as well where you can reach out if you want to work with me or have any questions at all. I am someone who is really passionate about making nutrition education accessible, and I just want everyone to be able to make informed decisions about their choices and about their health. And kidney health is one that I'm super passionate about. So super honored to be able to present for AAKP, and I just want to thank you for joining me today.
Edith, thank you for that great presentation. I'm sure our audience learned a lot today. I hope you can stick around for a little bit because we have a few questions from members of our audience that we'd like to ask you. Edith, are there any foods you should absolutely avoid if you have CKD?
Star fruit is one fruit that we do recommend that people avoid just because there is a component in it that can be toxic for those with kidney disease. However, for all other foods, there really isn't a hard, like, absolutely no. It does depend on where you are with kidney disease, like what stage you're at and how your labs are looking. But for the most part, we try to be as inclusive as possible by including all foods that you enjoy that are not going to be harmful for your kidneys.
How often can a CKD patient have animal protein, and which meats are best, beef, pork, chicken, or fish?
Great question. So with the animal proteins, it is again going to depend on what stage of kidney disease that you're at and what your urine levels and blood levels of protein are looking like. For the most part, we want to limit the red meats. So beef, pork, lamb, and game meats, we do recommend to limit those. And then for my patients, I do say that like chicken, fish, eggs are going to be better options for them.
And I have one last question. At what stage of kidney disease should a patient consider, give it some serious thoughts about seeing a renal dietitian?
As a dietitian, I think that at any stage, it's good to connect with the dietitian just to kind of see where you're at, the review your labs. They can also assess like, whether or not you should continue to work with the dietitian. But at the minimum, or at the like very least, I hope that all patients at stage 3 would seek out a dietitian just to give an overview of, kind of review the labs, see where they're at, and then make those little tweaks so that we can delay that disease progression.
Thank you, Edith Yang. We appreciate you sharing your expertise and experience with us. We appreciate it. I'd now like to introduce Brandi Nunez. Brandi is an AAKP ambassador and kidney transplant recipient from Louisiana. She was diagnosed with kidney disease in 2014 during a routine checkup. After discovering she had high blood pressure, further testing revealed she was already in stage 3 kidney failure. Due to a genetic condition, her kidney function declined rapidly, and by September 2017, she began dialysis. With her doctor's encouragement, Brandi chose home hemodialysis, which she describes as life changing. She continued to work full time, balancing her treatments with an active and fulfilling life. Brandi was fortunate to get the call that a new kidney was available for her in 2018. Her mission is to empower others to take an active role in managing their condition. Brandi, welcome to the program.
Hi, thank you.
So, we appreciate you joining us to answer a few questions and share your experience. The first question: when you were first diagnosed with kidney disease, how did your eating and meal planning change?
So when I was first diagnosed with kidney disease, it was stage 3. And for me, there was definitely like a grieving process to go through. Um, because it was completely sudden. Like I was in my mid-20s, I was in college. I just thought it was life that was kicking me. And so it was completely sudden when I got diagnosed. When I first was diagnosed, it was, like I said, it was oh my gosh, I just lost my words. It was like a grieving process. So my first instinct was denial. It's like, they're not going to tell me what I can and can't eat. Like they're not going to, you know, this is ridiculous. Um, it wasn't until a little bit further along in my diagnosis when I would actually be introduced to the numbers of my potassium rising and my phosphorus rising. And with those, I kind of told them they were lying. But that's really when I had to like drastically change my diet, because at first it was the high blood pressure. So we basically just had to kind of quit cooking with salt, which is hard at first because you're used to everything tasting a certain way, especially living in Louisiana. You know, we have all the good food. So it's really difficult to reduce your sodium intake. And then later on, when my potassium and my phosphorus numbers started to rise, it got a lot more complicated. And you really had to have like a multifaceted thought process on when you were making your meals, or even so like when you were eating out, like what did these meals actually contain? Um, and then of course you would see the results of that when you did your lab work. And I hope that answers your question.
Yeah, it does. Um, can you talk about, some of the biggest challenges you face when trying to follow a kidney-friendly diet? I know that you mentioned, watching your phosphorus and potassium. Can you talk about some of the other challenges you face?
So again, I live in the South, so we're all about like beans and rice and sausage and all of the, rich foods. And it was really hard to go to what I would call like a more bland diet, a more vegetable heavy diet. Um, and it really took a process. So maybe on Monday I would kind of eat what I wanted, but then Tuesday through Friday I would really have to be like, okay, I had, my essentially cheat meal. Now we've got to have, the meals that are better for your condition.
Did you work with a dietitian? And if so, what advice helped you the most?
The only dietitian I worked with was at the dialysis center. Because when I first started home hemodialysis, you have to go train. And so you're at the dialysis center, and they have a dietitian that comes around, and they give you tips and tricks. And then a little bit later on, I found there's actually a recipe booklet that the Association of Kidney Patients has, and that's really nice because it literally lays out like the nutrients in the meal, like if it's good for somebody who's on dialysis, if it's good for somebody who's had a transplant. So it's really thoughtless. um with that, I also decided that I was going to get a heart healthy cookbook, And that was really a result of my father had gone through bypass surgery. So he had his own diet to follow, and thinking that, okay, well, they need to have a lower sodium diet. These ideas can at least help me with the sodium aspect of it. And then I would just have to be mindful of the items that have potassium and that have phosphorus in it. And with that, so my phosphorus would kind of bounce around, and like when you're even when you're like healthy, you know about sodium, you know about potassium, you know about all these electrolytes. Nobody really tells you about phosphorus. And that was a challenge for me because it really could affect your ability to have surgery, because with phosphorus, it pulls the calcium out of your bones and deposits it in your arteries. So it's not something that you want to have happen. And then you're like, okay, well, I don't want this to happen. How can I handle it? Or like, how can I manage it? Excuse me. Well, one of the dietitians I was seeing really hit home. They said phosphorus is a preservative. And that was just like an eye-opening moment. I was like, okay, so no bags and boxes. Got it. And that point to me was really when I like could start managing what I was dealing with. Like okay, I don't, this thing's in a box or a bag that I eat. Like, we're talking frozen waffles, we're talking pancakes, we're talking sausage. Like, these things comes in bags, and to keep them fresh, there's preservatives in them. So how do I make them on my own? And that's really where I started to excel. Was I found something to focus on, and that was how to make these things I liked myself.
Yeah, I like the idea of no bags or boxes. Also, the AAKP nutrition counter you mentioned earlier can be downloaded from our website for free. So if anyone's watching wants to take a look at it, just go to the AAKP website. My next question for you is: were there any specific foods you had to consume less of or give up entirely that were especially difficult? And if so, how did you manage that? Did you find any alternatives?
So for me in my situation, we learned that moderation was the best approach. And I've realized that not everybody's journey is the same. So moderation might not be your best approach. Um, but say again, I live in the South, so we're like potatoes, all the good food. And so that's a really hard one to give up, because we have French fries with everything. You have a po' boy, you have French fries. You have a burger, you have French fries. You have a chicken sandwich, you have French fries. You have a roast beef sandwich, you have French fries. So that's, or potato chips. So that was a really hard one for me. And it we learned through my labs that it was really just a moderation thing with that. Now, if I had a potato, I had to be conscious of anything else that had potassium in it. So we're talking oranges, beans, tomatoes. So it really was a balance that we had to get comfortable with if those were the things I wanted to eat.
How did you balance your kidney-friendly eating plan while also working full time and maintaining your daily routine?
Packed my lunch. If I didn't pack my lunch, it was a very health conscious choice in what I was eating. Either I would go pick up salad, or mainly a salad is what I would go for if I didn't pack my lunch. But I would usually bring a sandwich, and that pretty much kept me on track.
How did your dietary needs change once you had a kidney transplant?
got a lot easier. The potassium maintenance was gone. I don't know if that's really a term, but like I really didn't have to monitor my potassium anymore. The phosphorus monitoring, that was all gone. What I learned that I was still kind of dealing with, which I expected to go away, was really the iron deficiency, which I guess I didn't talk about that before, like the iron deficiency. That unfortunately I couldn't manage with food on dialysis. I had to get iron supplements. So that not having to get the iron supplements post transplant was really nice, but I expected it to go away. And it's kind of like an ebb and flow. There are times where I need to manage it a little bit more strictly than not. And we just see that through my labs. And then also with the magnesium, well, there'll just be a random set of labs where my magnesium is horribly low. But I've learned to manage that with diet as well. And when it's low, I just make sure I eat a few more rich foods, like magnesium rich foods, and that tends to balance it out.
What would you say to someone preparing for a kidney transplant who is concerned about maintaining their health afterwards?
After transplant is a completely different world. While you're on dialysis, it's just 100% bad news all the time. And there's really nothing you can do to help yourself. Once you have your transplant, it's a new life, at least for me. Yes, the medications, some people don't want to balance the medications, but for me, I'd rather balance my immunosuppressants than balance my diet like I had to, and to balance my time, to have that time available for dialysis. For me, I don't have any dietary restrictions. Um, I've kind of gone through a point in my life right this second where I'm just not making the best food choices. But we're working on changing that. But as far as like, I can eat potatoes now, I can, cheese, sausage, pretty much whatever I want. There's no restrictions.
Yeah. And what tips would you give to others who are struggling to follow their own kidney friendly diet?
Are you talking pre or post transplant?
Pre transplant.
Okay. Okay. So for pre transplant, again, it was a grieving process. Go through that grieving process. Like, because once you get to the other side, you're going to learn. Like, once you get through that grieving process, the stages of denial and the whole series, you're going to learn that there's certain things that you just can't control. But you're going to learn that there are things that you can manage. And you really just grip onto those things that you can manage and you live through them. So you can manage making your own food instead of grabbing bags and boxes. Yes, it takes longer. Yes, it may seem a little bit more expensive. But if your goal is to have a transplant, if you have high phosphorus and you end up with those calcified arteries, it's not going to end well. So, definitely hold on to those things that you can control and then work with your doctors to manage the rest.
Brandi, thank you for sharing your time and responding to a few questions about what it's like to follow a kidney friendly diet. We appreciate you being with us. Now, we did get some questions from our audience as they were registering for today's program that I'd like to ask you now. So I'll get to those. So, Brandi, how did you handle eating out as a dialysis patient? So, when you went out to eat, how did you handle, following
Oh boy.
a kidney friendly meal diet?
Again, for me, it was really just being mindful of what I ate. And you really had to plan eating out. Like, if you just ate out all the time, like that's not going to work out well. That's not going to work out well for your labs. It's not good, that's not going to work out well. You have to plan for when you want to eat. That has to be your treat. And then again, you just have to kind of be mindful of what you're ordering, because tomatoes are going to affect your potassium. So if you're going to a Mexican restaurant, the salsa is not going to be the best for you. The refried beans, the black beans, those things aren't going to be the best for you. If you're grabbing a burger, again, there's going to be tomatoes on the burger. There's going to be ketchup on the burger. There's going to be, more than likely, there's fries with it. And, maybe you can swap the fries for a salad. It's not ideal, but it's what's going to be better for the long run. And again, especially if your goal is to have a transplant.
Now, have you encountered any unexpected challenges post-transplant related to food or nutrition?
Not necessarily. Again, I didn't expect the challenges with my iron and with my magnesium that I've faced. And it wasn't like a big challenge. It's just kind of like, man, I'm not really feeling the focus at work. And I would have a set of labs done just in routine, and it would reveal that my iron was low. And it's like, okay, shoot, this is probably what's going on with me right now. And another tip I had learned, and I guess I needed to share this back when you asked about dietitians. So if you're having issues with your iron, what they explained to me was that iron will absorb better with vitamin C, and pretty much not at all with dairy. So what I would do when those labs would reveal that my iron was low, now that I've had a transplant, I don't take the iron pills anymore. I don't want to take the iron pills anymore if I don't have to. But since I don't have food restrictions, I would make a smoothie. I would drink it first thing in the morning before anything else was in my stomach. And it would be some frozen berries and some spinach and some orange juice. And it's not the best tasting thing, but it really did help that brain fog and my iron numbers return. And then when my magnesium numbers were low, I would just grill up some mushrooms. I know not everybody loves mushrooms, but it was the best thing that worked for me.
Thank you, Edith Yang and Brandi Nunez. We appreciate you sharing your expertise and experiences. I appreciate it. If anyone watching has additional questions for our speakers or about today's webinar that we were unable to get to, please email us at info@aakp.org, noting the webinar title in the email subject line. We want to highlight some upcoming awareness days and invite you to join us in recognizing these important events. Save the date for April 5th, National Phosphorus Awareness Day. AAKP is committed to helping you learn more about the hidden P in kidney disease. This day is dedicated to raising awareness about phosphorus levels and its impact on kidney health. High phosphorus, known as hyperphosphatemia, can lead to serious health issues. AAKP encourages individuals affected by kidney disease to stay informed and take proactive steps to manage their phosphorus level. Did you know that May 1st, or 5.1, represents the upper limit of a healthy blood potassium range? That's why every year on this day, AAKP brings together kidney patients, family members, care partners, and healthcare professionals for the Are You OK campaign in observance of National High Potassium Awareness Day. We're raising awareness about high potassium and why it's so important for people with kidney disease to understand and manage their potassium levels. Join us in spreading the word and learning how to keep your potassium in check. Save the date for June 3rd, National Itch Day. Ever heard of chronic kidney disease associated pruritus, or CKD-AP? It's a severe, relentless itch that many kidney patients experience, but it often goes undiagnosed and untreated. That's why AAKP's Stop the Itch campaign is shining a spotlight on this overlooked symptom. Join us on June 3rd to help spread awareness and push for better care for those who are suffering. Let's work together to make a difference. Thank you for your support in recognizing these vital awareness days. In closing, if you are not already a member of AAKP, we encourage you to join. AAKP offers free memberships to patients and family members, as well as living kidney donors. To become a free member, join online at aakp.org/join or by phone at 1-800-749-2257. To receive all the benefits of membership, please be sure to include your email address when signing up. As an AAKP member, you will be notified about all of AAKP's upcoming events, the latest in our educational program series, and when opportunities arise where your opinions and experiences are needed to help inform innovation, advance care, and make a significant impact to improve lives. We encourage you to respond to our flash surveys and other engagement opportunities to help us elevate the independent patient voice and change status quo kidney care. You'll also receive a digital subscription to our bi-monthly magazine, AAKP Renal Life, and can select to receive any of our 5 different electronic newsletters, all for just signing up. We also invite you to check out our blog to read some great articles and patient profile stories, and follow us on social media for all the latest news and to keep up on what's trending. AAKP is dedicated to helping kidney patients across the disease spectrum understand their condition and take control of their healthcare. We are proud to offer a variety of resources for both patients and care partners. By visiting our website at aakp.org and clicking on the AAKP Store button at the top of the homepage, you can find a variety of educational brochures, online tools to order or download free of charge, including titles such as Nutrition Counter, a reference guide for the kidney patient, available in English and Spanish, and Pocket Guide to Managing High Potassium, as well as Understanding Food Nutrition Fact Labels brochure. You can also order materials by phone. Did you know AAKP created a recipe series program to support those affected by kidney disease? It's called AAKP Delicious. It includes more than 100 kidney-friendly recipes developed to help you cook healthy, delicious meals that fit your kidney diet, whether you're a patient or a family member, in your effort to take charge of your healthcare through nutrition. Our 6th and 7th editions of AAKP Delicious include short, on-demand cooking demos of all the recipes that you can easily follow along. Recipe ingredients can be modified to fit your specific need. Be sure to consult your renal dietitian if you have any questions on how to incorporate any of AAKP's recipes into your daily diet. Purchase all 7 editions of AAKP Delicious and start your collection today. We are excited to announce the dates of our 2025 events. The AAKP National Patient Advocacy Day will take place on March 12th, 2025. This is a virtual event that will allow AAKP members to talk to congressional members and their staff about legislative issues and policies that are important to kidney patients and their families. The 7th Annual Global Summit on Kidney Disease Innovation, in partnership with George Washington University School of Medicine and Health Sciences, will take place May 22nd and 23rd. The 8th Annual Policy Summit is scheduled to happen in June and will take place in Washington, D.C. And the 50th Annual National Patient Meeting will also be a hybrid event taking place in October 3rd through the 5th. We invite you to let us know which events you are interested in participating in this year, and we'll be sure to notify you when registration is open. Finally, you can visit our YouTube channel to watch a number of great presentations and webinars, all available on demand from our 2024 events and programs, as well as 2025 programs as they occur. Again, thank you, Edith Yang, Brandi Nunez, for participating in today's AAKP HealthLine webinar. We appreciate everyone's time and expertise helping to make this event meaningful and informative. Thank you all for joining us. Have a great day.